My name's Cindy Levitt. I'm a professional organizer and my business is called Piece by Piece. I'm self-employed, and so therefore I'm in that lucky group of people that doesn't have a group health insurance plan. So I pay a lot of money every other month for my health insurance, and I feel like it's just ridiculous because I could be using that money for building my business, for other things that I need to pay for. I'm a very healthy person. I do a lot of preventative wellness stuff, and I still feel like I spend so much on health insurance that it's just a burden to me every month. I have my bill here that was due it was due a few days ago, and I haven't paid it yet. It's a few days late because it pains me every time I have to get the checkbook out and figure out which account go into my savings to pay for my health insurance. I just wish there was some way that self-employed people could have a group to belong to that was actually affordable and that would take into account those of us that try to stay healthy and do preventative things. My sister doesn't have health insurance at all. She's a little bit younger than me, and she takes a huge risk because she does own a condo, and I worry about her as well. I worry about myself being able to pay my premium and what would happen if I couldn't. What would happen if I had some catastrophic hospitalization. So that's why I keep paying. I have a high deductible, but I still have high rates every other month. And like I said, it's just a big stress and a burden for me to figure out what to do every other month, how I'm going to get this paid.
My name is Michelle Nicolay, and I do website consulting for a nonprofit here in Chicago.
Okay, and then how do you get health care for yourself and your family?
My husband is also self-employed, so we have to purchase an individual policy through the individual insurance market. Right now, the only way that it can really be affordable to us is to get a high deductible plan. So I believe our deductible right now is $2,000 per individual in my household. We've experienced 5 to 10% increases every year over the course of the last 12 years since I've had individual insurance. But you jigger around with the deductible in order to keep it affordable, essentially. So 8 years ago, my son was probably around 4 years old. He had been seeing a pediatric ophthalmologist since he was 6 years old, or 6 months old, for a condition called exotropia, which is essentially his eyes weren't tracking, but had never really required treatment other than monitoring. My husband and I were 4 or 5 days late one month paying our health insurance premium, and the insurance company terminated our policy, which I understand. But when we called them and went back and asked them to reinstate us, they refused to reinstate my son to our family policy because of his pre-existing condition. We ended up having to go to a program offered through the state of Illinois for people who are otherwise uninsured policy. I believe, if I'm remembering this correctly, the premium for that policy for my son alone was 2/3 the cost of what we were paying for the rest of the family. He remained on that policy for a couple of years until my husband was able to convince our private insurer to reinstate him back into our family policy with the provision that his eyes and anything related to his eyes are excluded. So my son's now a little over 12 years old, has never had to have any treatment or surgery for this eye condition. And some simple things like immunizations. When my son was an infant, we had to pay for all of his routine immunizations out of pocket, which over the course of the first 2 or 3 years of life adds up to well over $1,000. So those kinds of things are a frustration. I have to say it's also a worry to me sometimes where we would be able to obtain coverage should the insurance company decide to stop offering this product or stop offering this product to my family, because my husband and I are both over 50 now. And I think that we're probably getting into an area where they would consider us an undue risk. So it's a peace of mind issue for me as well.
So what would you like to see change? What needs to be changed for you personally with healthcare?
For me personally, with healthcare, I would like to have more easy, affordable access. I'd like to be guaranteed that I could get some kind of policy that would be affordable to my family and that would provide me access to basic fundamental preventative services in an affordable way. I feel like right now I'm spending, a not insubstantial sum every month for insurance that doesn't cover any of my everyday preventive care. So I have to pay for that on top of my policy, making health care a not insubstantial piece of my budget on an annual basis. So I would like to know that I would be guaranteed to get some kind of policy, and I would like to have more affordable access to preventive care for myself and my children.
My name's John Bowman. I'm the president of a small not-for-profit, about 30 employees. We do advocacy work to fight poverty. Like I said, I have about 30 employees. They're of various ages. And we provide health insurance for them. It's one of the most important things we do because we don't pay them very much in terms of salary. And it is a constant headache, a constant unpredictable budget mess. For example, just this past year, at our annual review of our insurance policy, lo and behold, we found we were going to get a 25% premium increase to continue the same coverage. So I'm faced with this choice of either passing that along to employees who I don't pay very well, or diluting their coverage, or eating more of it ourselves when we hadn't budgeted for it, and we have a very tight budget. So one of the problems is it's completely unpredictable. The other problem is that I have no, I'm afloat on this ocean. I have no control over it whatsoever. So, what we ended up doing is what we end up doing every couple of years. We went shopping for a replacement policy. We found one. It was still an increase that was greater than what we had budgeted for, but not as great. There are some of the co-payments and expenses that my employees have to pay are going to be greater. Some of the coverages are going to be a little less. And so we sort of navigated our way through it again, but it was like something completely out of my control. The costs are rising not for me, for the employee, for healthcare itself, every single year, and this stuff has got to stop. We've got to get a handle on it.
What would help your place of business most?
To have a good, solid, stable way to get affordable, decent coverage for everyone that doesn't cost as much as it costs now, but that provides good health care to people. I'm willing to pay my share, as I have been, and the employees are willing to pay their share, as they have been, but we got to get some control over this, and we got to get some peace of mind about it.